It's Thursday, and Thursdays are meant for us to discuss on health-related matters. Good afternoon, and thank you for joining me on yet another edition of the program You and Your Health at Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. One of the major reasons why couples opt for medically assisted reproduction in Cameroon is because of fertility issues. But then, what are some of the risk factors? What can cause someone to be regarded as infertile? That will be taught after the short break. Once more, thank you for choosing Equinoxe Radio and Television to be informed on health-related issues. And with me right here in the studio is Dr. Jacques Tingang Kamgang, a gynecologist and obstetrician, specialist of assistant medical procreation. It is a pleasure having you on the program once more.
Thank you, Immaculate. Good afternoon to auditors and televiewers.
Last time we discussed about medically assisted reproduction in Cameroon. This time around we'll be talking about a related topic because it's because of this that leads to the other. So now we'll be talking about infertility.
Yeah.
What exactly is infertility?
Yeah, thank you, Immaculate. Infertility is defined as inability of a couple, I repeat, a couple to conceive after adequate exposure to pregnancy for about 1 year. Adequate exposure to pregnancy is like 3 days of sexual intercourse per week. 1 per day for 3 days per week, like that for 1 year. If the woman does not conceive, we consider the couple as infertile.
Now, you insisted on a couple.
Yes.
I want to know, does the causes of infertility differ from the man and the woman?
Yes, the causes is multifactorial, and the causes of infertility is multifactorial. It can depend from the woman or the man. So normally, those days they thought that it was the woman that is infertile.
Exactly.
It's a couple. Nowadays, the man and the woman share equal responsibility in infertility. What do I mean? The cause 40% of cause of infertility is related to the woman, and 40% the man, and 20% the two. So it's 50-50.
Okay.
So, yeah.
So now, what are the major causes of infertility?
Major causes of infertility is a couple, so the causes can be female or male. Most of the time we have infection in our country, which is common. Sexually transmitted infection is the leading cause, which very deleterious for the tubes in the woman and also for the genitalia of the man, and it can alter the quality of the semen in the man. In the woman, a STD will lead to tubal obstruction most of the time. One episode of infection of chlamydia mycoplasma in a woman will lead to 15% of risk of obstructing of the fallopian tube, where the fertilization occur, and 5 days later before the embryo get implanted in the womb. So you have infertility, you have sexually transmitted infections. You can have you have to stratify. You can have causes. Infection, you can have causes linked to the uterus, like fibroid. You can have causes before the uterus, like vaginitis, that is infection. You can have ovarian, at the ovarian stage, that is the difficulty of the woman to ovulate. You can have also causes at the upper stage, that is related to stress, to environmental, and maybe the common of the brain to the ovaries and to the uterus. And the same in the male is the same infection, and you can also have trouble of ejaculation in the men. You can have an ejaculation. There are people who have intercourse but do not ejaculate, or some dysfunction that may make the semen not to go out but go back to the bladder. And also, those are some of the obstructive causes, and they might also not be able to release the semen.
And can a previous abortion affect fertility?
Of course, previous abortion, especially if it's not well managed.
Okay.
Because it's mainly unsafe abortion. If the abortion is carried out on the in the environment which is not suitable, that is where the aseptic procedure are not respected, the personnel carrying out abortion should be qualified and the adequate technique and respect the rules of hygiene. Otherwise, you may end up with some complication like infection of the cervix, of the womb, and tubal obstruction again. You come sepsis, and in some situations it can be even worse, that the womb can get collapsed at the end of the infection. That is the collapse, and later on the woman may not even have menses or something of the sort.
Okay. So now, what about birth control pills? Can they equally affect fertility?
Birth control pill and fertility, not really. If it's well taken, the normal every day, when woman stop pill, she regain her fertility. But what may arise, because when woman is taking oral contraceptive pills, if she forgets that she is not protected against STD, she may expose herself, and she will be at risk for sexually transmitted infection like chlamydia, mycoplasma, and later on the tube may be blocked. Not because of the pill itself doesn't alter fertility.
You talked about taking the pills well. Then how do you take pills to know that you're doing it the right way? Because some people could just go about taking it any time. Maybe they just had unprotected cells and they go about. What's the right way of taking pills?
No, the right way of taking pills, you should see a health provider or somebody who is trained, who study your body and okay, this type of pill suits you. Then they advise you to take the pill at the same time every day. And if you miss the pill, you know that you maybe have to take, when you remember, you take 2 tablets at the same at the time. If you have missed like 2-3 days, you are no longer protected. So right way is tablet every day. There are different types of pills. That you take 21 days, you stop 7 days. Others will be 21 days after there are 7 tablets of iron. There are many. The health provider advise the woman on how she should take it.
So now, what are some of the manifestations of infertility? How can I tell that I am infertile?
Tell you're infertile is, first of all, you must be exposed to the pregnancy. It means you must have adequate exposure to pregnancy, and after 1 year, if after 1 year the woman don't conceive, you consider the couple to be infertile. Now, she can complain, the woman can complain, or the man too can complain of low abdominal pain. Low abdominal pain is usually sign related either to sexually transmitted infection with infection around the tube, as I said earlier, or it can also be linked to disease like endometriosis. Endometriosis is associated with painful menses and low abdominal pain too, and also pain during sexual intercourse. She may have trouble of her cycle. Trouble of the cycle. The cycle may be longer. We call this panomenorrhea, cycle of 45 days, 60 days, or it can even make 3 months. We call it amenorrhea in that case. Therefore, we can think about disease like polycystic ovaries, which is associated to trouble of ovulation at the level of the ovary and associated with infertility.
Okay. If you're just joining us, then know you're listening and at the same time watching the program You're on Your Health aired on Equinoxe Radio Multimedia. And to participate in the program, you can call the following numbers: 655-511111 or 652-025050. We are all here to answer to all your questions related to infertility. So back to you now, doctor. What are some of the risk factors?
The risk factor of infertility may be let's say early sexual intercourse.
Okay.
Before 16, multiple partners, men or women. You make the woman and the man also be exposed to risk. We have said earlier. Most of it, or if there are also congenital risk, a woman who is born without a womb, yes, it's possible not to. It's the womb that carries the baby, not to procreate. It can be entire malformation of the womb tubes and everything, or a woman doesn't have vagina at all, or it exists. This malformation, that situation is quite difficult. We talk about infection. Yeah, those are some of the of the risk factors of infertility, multiple partner, as I've said earlier.
Now, you said at least the couple must have taken about let's say a year, carrying out the activity about 3 times in a week. So now, can they just conclude that either the woman or the man is infertile, or they still have to go to the hospital to be sure with the diagnosis?
No, they have to consult. They have to call a health provider. A health provider, it can be a general practitioner who first work up, and rapidly, if he knows that he is limited, he can send to the gynecologist, and even the gynecologist take care at a certain moment. If he feels that he's not longer at his own level, he has to send to a specialist of assistant medical procreation. So it's 1 year. After 1 year, 80% of the couple should conceive. It remains 20 that will not conceive. Then the gynecologist specialist in fertility will take care and try to work up. Is there analysis to be done? Physical examination, is it correct? Ecography, X-ray of the tubes, are they patent? Ecography to show the womb, the ovaries, are they eggs or not? And hormonal profile, is she secreting well to expect the ovaries to produce eggs? And the same for man, and the man should undergo physical examination. We should try to examine men. When the couple comes in the office, first of all, you start the consultation. You can see them. You can see the woman who has bleached herself. You know that you have to insist. You see a woman who has more beer or things like that. You know that this one secretes more testosterone and androgen, and likely the ovulation may have a problem. Or a man who has a female shape may have also problem with the testes, things like that. When you examine them, then you ask analysis of top of the woman. For the man too, you have to make workup, sperm analysis, ecography, physical examination too. When you examine them, at time, you will discover that the man will wear tight pants. The testes are down because they have to be in the cold. So the men are advised to wear very how you call it, anglais. It has to be large, not to tie the testes, because you can produce the spermatozoa normally, and because of the heat, they become non-motile, and lead to inability to fertilize the oocyte.
And can infertility be treated?
Of course, it can be treated. It can be treated. We have many specialists in the Cameroon that have been trained in the different universities, and they are ready to take care. It's important to consult the health professionals who are well trained, and they will work up the couple and propose solution to you. There's step by steps. It's not when you come that after 1 month you conclude that it can take, for others it can take 1 month or 2. Because of the consultation, the advice you give, the information education, you tell them how to go about the intercourse. After 1 or 2 months, some will conceive, others will undergo investigation, propose the stimulation of the ovaries, propose treatment for the man, propose insemination, IVF or ICSI, or some at the end. If there are couple that at the end, even if, despite the assistant medical procreation, will not be able to conceive, for those people, you advise them to do adoption or surrogacy for if it was possible. But for now, the law, the recent law is forbidden. So.
Exactly. So now, let's say a woman who has been confirmed infertile, can she still see her menses?
Of course, if an infertile woman can see her menses, she may not see her menses a specific condition, as I said. If you have a malformation of at birth, she doesn't have a womb, she will never see her menses. She will start getting worried at 14, 15, 16, 17, when all her friends have found she doesn't have. It's impossible. It will be impossible for her to create a womb for now. But the woman who have seen her menses and suddenly it disappears, it might be secondary to unsafe abortion, as I said earlier, with uterine synecia, the wall comes together, or he can have prolonged cycle after 45 days to 2 months, and but most of the time, the women, they see their menses. The tubal obstruction does not impede them to have the menses.
Okay. So now, within our Cameroonian context, you are a gynecologist, and I guess you have worked with a lot of couples on infertility. How common is infertility in Cameroon?
Yeah, infertility is becoming a public health issue in our country. I think it's between 15 to 20% of couple. That's one of our fit couple is infertile.
So,
yes.
What last advice do you have for those who have been searching for the fruit of the womb for several years, but they haven't been able to have an answer or something that can make them smile back? What advice do you have for those women that have been praying? Even the men too, as you rightly said, it concerns a couple.
No, let the couple not get discouraged. They should only try to find a good center, a good hospital where you have trained gynecologists. There are many in Yaoundé, in Douala, all over the country. I think even in a remote area nowadays, you have gynecologists. They will consult, they will work up their situation, propose solutions to them. And I think they are open nowadays. We have many patient couple referred from the remote area for assistant medical procreation, because now they know that now it's possible in our country. In those days, they had to take a flight either to Europe or to South Africa or to US to have procreation. But nowadays, the tendency is different. We have many patients coming in from Europe.
And how much does it cost?
What?
Assistant medical. Exactly. We want to know, how much does it cost?
It depends. Assistant medical procreation, it depends on what you mean. The consultation, after the first consultation and ecography, and you advise them, their couple that come after 1 month, they are already pregnant. That one will cost what? Maybe 15,000, 20,000 for ecography, 35,000. But now you have to go to stimulate the ovaries of the woman. It depends, ovarian stimulation, it depends on with what you stimulate. So talking about the price, you can have protocol that will cost 20,000, or that will cost 150,000. If you do one insemination, you can be up to 300. But when you come to IVF or IVF with normal IVF, classical IVF or ICSI, it can vary between 2 million to 3 million, depending on whether you do with the ovary of the woman or the oocyte donation.
Okay, thank you so much, Doctor, for your time. That was Dr. Jacques Tingang Kamgang. He is a gynecologist and obstetrician, specialist of assistant medical procreation. And that's where we end this edition of the program, You're in Your Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received medical and technical assistance from Raphael Dipanda. Have a lovely day in the company of more programs on Equinoxe Radio and, of course, television. So long.